So some really like basic stuff around logistically planning for your physical health, basically. So a good thing to do before you go is to book an appointment with your doctor. The earlier the better, but then you might need another one like right before you go on the project as well. So, you want to discuss any vaccinations, you want to catch up on vaccinations that you would usually have in the UK as well, but that you might not have, got around to getting yet. COVID vaccines as well, in particular nowadays. But then also if you have any prescriptions like inhalers or any regular medication you have, it's just really useful to sometimes request extra ones of those and make sure you get them in advance, because say you're away for 2 months, you might usually get another prescription in that time, but you can't do that if you're away. So it's good to kind of plan for those eventualities. Also take out travel insurance. So we have a bit of insurance, around groups and being a charity, but in terms of your individual travel insurance and, protecting your health while you're out there, it's good to have your own comprehensive insurance and keep those documents with you. And then you might also want to get malaria tablets. So some GPs are quite good with them and they might give you them for reduced prices, but other places you might just have to buy them from like a travel clinic. So it's good to kind of get those in advance as well. And depending on which malaria tablets you're taking, some of them you have to start quite a lot in advance before you go, and some of them you don't. So it's good to, plan in advance. Not like when I went to India and I thought about it a week before. So yeah, it's really good to do that much quicker than me. Did anyone have anything they wanted to add about that slide, or any questions about that? If you do think of something but I'm talking, you can put it in the chat as well, that's fine.
One comment from me would be something that's come up in previous years. We had volunteers sort of not realizing that they were planning to travel after the project. So we had one volunteer who I think wanted to go from Malawi to other countries in East Africa, and they realized that they needed to travel sort of internally within Africa, they need a yellow fever certificate. So I think, just bear in mind that there might be different health requirements in different countries if you're planning on sort of hopping around a few countries after your project as well.
Cool. It's useful, those links as well, to have a look on those, because they can kind of update you on what vaccines you'll need for that place, and hopefully your GP or the travel vaccination centre you speak to should have that information, but just for your own record you might want to look up that as well. So think about what kind of work you'll be doing while you're there, and how long are you there for on the whole, but also how long is the actual work taking place in the day. What's the climate like, what the weather's going to be like, and what kind of terrain are you going to be in. So for example, are you in the countryside, or are you in a city, or are you in a school every day? And quite an important one as well is not necessarily what risks there are to you, but what risks might you pose to the people you're with as well. So, in particular COVID and things like that. And then not just thinking about the actual project time, but also any free time you might have, if you're traveling somewhere else afterwards or beforehand, you might want to think about those physical risks as well. So considering all of that, do you guys want to think of any safety measures you might want to take to reduce those risks? Or Sam, you want to add some as well?
I think something for me is sort of how you get from one place to another in the safest possible way. And I think one thing I would say as well is about the time of day that you're traveling as well, because I think it might be a case that in the UK it's no big deal to take a train that's sort of 10 o'clock at night until midnight. But if you're in rural Nepal, then sort of you try to travel much less after dark, because that's when there's a lot more road traffic accidents. Mm-hmm. Because obviously the roads are not as good quality, and there's sort of there's not many street lights around and that kind of thing. So yeah.
Mm-hmm. Yeah, and I guess I don't want to say we can rely too much on our trains with the strikes and everything, but yeah, you can kind of rely on like getting the last train when you're here, but then in other places when it's a bit more sporadic, you don't want to leave it to chance with relying on one form of transport kind of thing. So an important thing to think about when what you're taking with you to support your health is what you will have access to when you're there, and what you should take with you. So I think in general, obviously you won't be able to access all the things you would want, but in general, like near your hotel, you can get quite a lot of it, but it's good to have it on hand anyway. So yeah, footwear, and in particular hats and sunglasses and sun cream is really important, because there's nothing worse than going somewhere and then getting heat stroke and dehydration and sunburn and everything that's like quite avoidable. As well as your vaccinations, you might need to take mosquito nets and mosquito spray and bite cream and sun cream, and just the usual first aid kits you'd have here with plasters and antiseptic wipes and all that kind of thing. And then particularly because of COVID, take in sanitizer and masks as much as you can. And then kind of, as Sam said before, drinking only bottled water if you can, and not having ice cubes as well is quite useful because you don't know where the ice cube water has come from. Was there anything else you wanted to add to the checklist in terms of health items?
Is it worth checking? Is it worth people checking what type of masks are required in different settings? I mean, I don't know what the requirement is in France, but I know, for example, if you go to Germany, when I went to Germany a few weeks ago, and the requirement there was that you had to have the KF94 or equivalent masks rather than the kind of medical ones or the cloth ones.
Yeah, that's really useful actually, and I suppose taking COVID tests as well if you can take them. When I went to Cuba really recently, we were really careful in the days, but then when you think about the airports as well, and you're around a lot of people then, so it's important to think about reducing the transmission before you even get there. And quite a lot of people on our camp had to actually go to like a Cuban isolation centre for like 2 weeks, so you really don't want that, as well as really not wanting to infect people, obviously. These are just some websites that you can look at afterwards of just like general advice pages and travel essentials, so you can use them as a bit of a checklist when you're packing and when you're planning. And if you have any questions after those, obviously you can just email us as well.